Good morning, everyone, and thank you for joining us for another episode of the Lifeline webinar series. In this series, we host a diverse set of top global talent to address issues of concern that we deal with on a regular basis, and especially during this pandemic. My name is Nnamani MD PhD, the founder of A Professional Africa website, aprofessionalafrica.com. We are the leader in curating webinars and lectures that meet objectives of clients, including government agencies in Africa, U.S. Chambers of Commerce, and more. We are also the leader in offering top online courses for Africa that both help job seekers meet employer demand and help employers attain their expected income. Our products and services differentiate our customers from others. Today we have Dr. Chiamaka Nnamani MD FAAP on Lifeline. She'll be talking to us about the health of babies, children, and young adults. Dr. Nnamani, thank you for joining us on the Lifeline.
Thank you for having me.
Please tell us a little bit about yourself and what you do for a living.
So, as you already introduced me, I am Dr. Chiamaka Nnamani MD. So, we're sisters, yay! I am a pediatrician by profession. I currently work in Annville, Pennsylvania, and live in Hershey, the sweetest place on earth. I absolutely love what I do. I am a mother of now 3 children, a 2-month-old baby boy, 2.5 months actually, an 8-year-old girl, and a 6-year-old girl, Amara, Ola, and Tochi. And I'm also a wife to Chiamaka Nnamani. So a little bit about myself.
That's great. That's great. Congratulations on your new baby and for taking time out to join us today. Tell us a little bit. So you are in the field of medicine, you're a pediatrician. Tell us what made you get into the field of medicine and pediatrics specifically?
So medicine, I actually kind of always knew that I was going to be a doctor. Our family doctor growing up back home in Nigeria was, I think, one of the greatest inspirations that I had growing up. So I also have always wanted to be be involved in people's lives directly. And, as you probably already know, I love to read textbooks actually in high school. I wasn't much of a novel person or fiction or, rom-coms or anything. Textbooks were more my thing. I loved biology, chemistry. So moving on to college, it was almost that natural thing to do. Now in med school, ironically, pediatrics was not what hit home at first. It was internal medicine just because I loved the medicine of it. But by match day, it was like a light bulb hit in my head, and it was like I had no other choice. I'm a firm believer in God, and I felt like I had a gut feeling, that this was the path for me. And I didn't realize actually the whole time I was in med school, I was using a pediatric stethoscope. So that was almost like an affirmation. And I've always loved children. Internal medicine was more of a thought just because I loved the actual medicine of it. But I am now being a practicing pediatrician, I don't even know how I would have done internal medicine. My personality, my passion is pediatrics. So yeah.
Yes, and you do it very well. We've heard some great things. So if you have students in school or in high school that are very good at chemistry and biology, those are some of the things that you want to be good at in order to do well in medicine, right?
Absolutely. But interestingly, actually, you do not have to be a chem major, a bio major, or a science major, actually, in order to go to medical school. You can be an economics major, a math major, a music major. You would only just have to fulfill the prerequisites for medical school. So you do not necessarily have to be a science major in order to get to medical school, as long as you fulfill those prerequisites of, obviously biology, chemistry, and math and your other basic sciences.
Okay, thank you. What do you enjoy most about your profession?
Oh, sorry, say that again.
What do you enjoy most about your profession?
Oh, what do I enjoy most? What do I not enjoy most? I guess should be the question. What do I not enjoy? absolutely love almost everything about it. I light up when I see the children, when I see the infants, the toddlers, the young adults, the teenagers, basically, not I would maybe say young adults. I love seeing the progress from birth, to see them grow to actually watch those changes and be a part of it. It's hard to mention one thing, so if you don't mind, I'll say maybe a few things that I like. I also like being directly involved with the families. When you have families who are going through tough times, maybe with the loss of a loved one, or transitioning with things, or just having a difficult time with a child, and being that person that they go to, someone that they trust, to open up to and help move things forward. Education is also a big passion of mine, so I love being an advocate for the children in that sense. If there are children who are not doing very well in school, or maybe who should have some kind of evaluation for learning disorder or something else, I enjoy being an advocate for these children in order, to help the schools evaluate these children. So it's a whole lot of things that I absolutely enjoy about pediatrics. But I think maybe the most I would say is just seeing the children, the innocence of the children, when they light up, the silly things they say. I can be silly every day of my life and not feel stupid for it. So yeah, I absolutely love that.
That's great. So what age range for pediatrics, what age range are we talking about?
Oh, so we're talking about birth to, it depends on the pediatrician that you ask, but if you want to go by the book, it's birth to 21. I choose to see birth to 18, because after you're 18, you start having adult problems, and I say goodbye to you. But birth to up until 21, a pediatrician can see you.
Wow, so that's babies to, in terms of school age, people in secondary school and high school then?
Absolutely.
Because
yes.
I think for me, when I think of pediatricians, for some reason in my head, I'm thinking babies to children.
Yep,
wow.
Absolutely.
Okay, that's new information for me. Thank you.
Mm-hmm.
What advice would you give to students that are thinking of studying pediatrics in the future?
Be passionate about it. I mean, I know in the world that we live today, it's a lot of times about the money you're going to make. If it's about the money, honestly, in today's world, there's a lot of other things you could do, maybe probably even make more money. I'm almost certain our younger brother makes more money than me. He's not a doctor. So I would say be passionate about what you do, because pediatrics, I mean, medicine is a field where you are giving so much of yourself. There's so much of yourself that you are, you just give. So it's hard to do it if you don't have passion for it. You will get burned out at some point. And if it's about the money, except if your parents are, millionaires or plan very well in the beginning, you will have student loans to pay back for a while. I am in that right now. So you want to think about that. But, so I would say number one, passion. It goes without saying, you have to love to read, except if you're a genius. I don't know that there's many Einsteins out there, but you have to be dedicated to reading a lot. It's a lot of years of your life that you have to give. So those are the two tough things I would say.
Yeah, it is a lot of years. I remember how long you spent in med school.
Yep.
From undergrad all the way through to med school to residency and the rest of it.
Residency, fellowship, if you want to specialize even more. Mm-hmm.
Right, fellowships, right, exactly. So to practice medicine in the US, because I know it's very different from practicing in Nigeria, in the UK, and so on, mm-hmm. What exams must a candidate pass? So can you walk us through the examinations, both oral and clinical, and just the whole shebang? Because I know there are people in different parts of the country that want to come into the US to work as doctors.
Sure. So go obviously your undergrad, I'm assuming that would be taken care of, obviously. So you have to have a some kind of bachelor's degree in order to get to medical school. You should have fulfilled those prerequisites, like I said earlier. Now you would need the USMLE. In order to practice, you need your 3 steps, we call them. So the USMLE, United States Medical Licensing Examination, steps 1 and 2 at the very minimum. Now, if you're an international student coming from Nigeria, the Caribbean, or just anywhere else besides America, you would it's probably a good idea to take your step 3 as well. Now, some residency programs will let you in without a step 3. So I'm sorry, I'm going to backtrack a bit. So your USMLE step 1 is a written exam that you take. It's, at least last time I checked, it was based on scores. So if you pass, you don't retake it. So it's not like you make an 80 and you're like, I really wanted to make a 95, so I'll take it like that. Accepted rules have changed, which I don't think they have. Once you pass, you've passed. Then there's a step 2. So there's a step 2 CK, which CK stands for clinical knowledge, and there's the CS, which stands for clinical sciences. The CK is the written one, and your CS is the oral exam. Okay, so you need these, I guess, 2.5/3 exams in order to get into residency. But like I said, as an international student, you want to probably have your step 3 because that increases your chances of getting in, because there's a lot, it's very competitive. And so once you have these, you can finish residency. And after residency, within 5 years, you need to have passed your pediatrics board. So they give you a bit of time to pass those boards.
Okay, thank you. That's great. Now I know that so you have lots of international students in the US who do their undergrad and then try to get into med school. So I guess, well, to get into med school, you need to pass what exam, first of all?
The USMLE step 1 and 2.
Okay, and then after that, you're typically placed you're placed somewhere for medicine. I know that lots of students face a lot of stress if they don't get matched in the US. What are other options that you would say are definitely really good, that kind of to go out and get that degree or get that element of medicine before coming back to practice here?
Sure. One that I've seen is very helpful is an MPH, so Masters in Public Health. A lot of doctors actually go back after practicing or while practicing and get their MPH, their Masters in Public Health. So that's a very good booster to have if in addition to all your steps 1, 2, and 3. So maybe some kind of Masters in Clinical Informatics. We are, now that we are in a digital age, with the use of Epic, which is a hospital-based program that we use, for charting, basically. So something along those lines, clinical informatics or Masters in Public Health, or some kind of clinical specialty, like a master's in the clinical specialty. Those are always boosters that will help your application for sure.
Now, there are other universities like in the Caribbean and so on that a lot of students go to, whether American or non-American. Can you speak a little bit about going over to the Caribbean or whatever for schooling and then coming back to take the other step examinations?
Absolutely. So I am actually what we would call an IMG. So I'm an international medical graduate. I am an American citizen. However, I went to Ross University, which is in the Caribbean. So basically, after my undergrad, with a lot of those Caribbean universities, you spend about half of your time on the island, and the other half, basically, you do your clinicals in the US. Now, I know some of them offer the options of doing part of your clinicals on the island, but it's something I think it's probably reasonable to. It depends on really what you want. I have friends who went to Ross with me and did some of their clinicals on the island, and it was a fantastic experience because the benefits of some of those is, they don't have the insurance issues that we have here, so you are more free to I guess kind of, I don't want to say experiment, but to learn. So you can learn more while you're there because you do not have those insurance issues that we have here and the paperwork and all that stuff that can be a little cumbersome. But at the same time, you don't get as much technicalities, because we have more of the equipment here in America, and most of those third world countries might not have all of that. So basically, if you go to school on an island, it's usually about 16 months or so that you spend, and basically that involves all your basic sciences, like your anatomy, your physiology, pathology, things like that, and then you come here for your clinicals. So after that, then you take your steps, like your steps 1. Hopefully that answers the question.
Yes, and so what increases your chances of getting placed here in the U.S.? I'm asking that because when I was getting, I'm in electrical engineering, and when I was in school, no one told me about an exam called the professional engineering exam or license to be a PE, because right after school, right after engineering school, that's the easiest and best time to take the exam. You're most likely to pass. I didn't find out about it till years later. And I'm just like, if I had known, I would have taken it back then. Are there things that, like even in terms of things to try to study, or ways to study to do better on the STEP exams? So basically, what increases your chances of getting placed in the U.S. After your step one? What would you say or think? What do you think about that?
The absolute truth is this: it's very competitive. Your best chance is to ace it. Is to have a really good score on your steps, especially as an IMG, because they're looking at a lot of other things, because it's competitive enough for the trained American citizens. Now, if you are an American citizen that's an IMG, then that kind of puts you lower. And then if you're a non-American citizen that's an IMG, then that puts you even lower. So what helps you get to the top of the ladder is having a very good score, and to be honest, having connections. So if you have friends that are in programs that are what we call IMG friendly, having them put a good word in for you. The good thing is that Nigerians have a very good reputation in most residency programs. So chances are, if you have some kind of connection and a good score, you will likely get in. But I would say those are the greatest things. Goes without saying, you really have to ace it. You have to ace it.
Okay, great. What advice would you give to current pediatric residents? Any advice at all?
Oh yeah, absolutely. Current pediatric residents, hang in there. Number one, it's a fun experience. It really is. Fun and hectic. I had 2 of my children in residency, so it was pretty crazy. I look back and I think, wow, if I did it, anyone can do it, honestly. Also, I would, one thing I kind of wish I did more, in retrospect, is there's something we call the Pediatrics in Review. It's a journal that pretty much all residency programs subscribe to. You automatically get it. That and the PrEP. It's called PrEP, PREP, all capitals. It's basically like a curriculum that helps you with practice questions and test your knowledge. I would say do that a lot. Your Peds in Review, it comes out once a month. Try to stay abreast of those things. It keeps you sharp, lets you know what the current evidence-based medicine is, changes that may have happened. So that PrEP is more like a Q bank, a question bank of about 200 questions. Trying to do that at least once a week, I would say, is helpful. Some residency programs already include that as part of their curriculum, like, during conferences and things. But if you can do that on your own personal time, I find that gives you a big boost, because, obviously it'll help you with your clinical knowledge, but also it'll help you to prepare for your ABP exams, your board exams when you're out. So you're having to do less work when you get out. So reading as much as possible, and obviously make time for yourself, make time for family, make time to have fun, get good recommendations, so get to know your professors, your attendings, or not college, your attendings, so that you can get good recommendations as well when you get out for a good job and things like that. So those are some of the tips that I would give. Yeah.
That's great. Thank you. Now let's get technical. You see several types of cases, several different types of children, different demographics. What cases do you see most among babies, then among children, and then among young adults in the U.S.?
Sure. So in babies, now again, a lot of the cases that we see depends on the time of the year. So, if it's usually in the fall and winter seasons, we see a lot of upper respiratory infections and even lower respiratory infections in all of the age groups, actually. But obviously, infants are more susceptible to them, to the infections, because they have less of an immune system, less of an immunity. So we see URIs, upper respiratory infections, LRIs, lower respiratory infections like pneumonia. URIs would be things like what we call bronchiolitis, which is basically you get like a wheezing sound a lot of times in infants again. We also see a lot of your ear infections, your middle ear infections. So what we call otitis media. We see that mostly a lot of times in the fall and winter seasons. We still see a lot of other, the regular case, other cases, but these are the most common things that we see. And then in the summertime, we see a lot more like injuries, so orthopedic stuff, because people are outside, they're playing, weather is nice, so you tend to see more sports injuries. We also see more skin things. So like your poison ivy dermatitis, we see a lot of that in the summertime. We also see your outer ear infections, so your otitis externa, because people are swimming. So you're susceptible to getting more outer ear infections. So we see a lot more of those in the summer. I think I'm forgetting something, and I'm sure it'll come to me. But then obviously with the teenagers, we see STDs all year round. So there's no, I don't know that there is, statistically what the numbers are, but we see that distributed all year round. So that's something that or at least I talk about with all my teenagers, preventative things for your STDs, getting tested on time, pregnancy. I've seen quite a few teenage pregnancies also. So those are some of the things that I see in the office. Yeah.
Yeah, okay.
Oh, I'm sorry. Yeah, that's what I was going to say. So in the summertime, we also see Lyme disease, because being a central PA, it's actually, you're more likely to get it here. There are parts of the country where you're more likely to get Lyme disease. Lyme disease is caused by a tick bite, a specific kind of tick, we call it the deer tick. So we, again, always tell parents, again, the summer and the fall, actually, if you're going to be out, try to cover up as much as possible, use your bug spray. And when you come home, if you're going to go on a hike or whatever, I usually advise parents to do a tick check, which basically involves stripping the child and checking behind the ears, everywhere, head to toe, for a possible tick bite, or tick, actually, not a bite, really, the tick, and trying to take a shower, as soon as possible when you get home.
Great, thank you. That's good. I was actually about to ask you some of the solutions and remedies that parents can do, with over-the-counter type medications or going in and getting prescriptions. But before we get into that, we have a question already. So someone says, a lot of us are now parents with kids. What advice would you give to parents on how to manage their kids' ill health, especially at night? I know I've faced that quite a bit myself with my son before taking them to the hospital. So again, home remedies. So considering that kids can't describe how they feel when they're ill, so it's a specific advice on different kinds of ill health, like convulsion, fever, diarrhea, fall injury, and so on, will be appreciated.
Okay, so I guess it's an interesting question to ask. If you're in the U.S., you obviously have a better chance, because if you're truly concerned, I would, most hospitals have a 24-hour, have doctors on call all the time, so you can call the nurse advice line and they can work you through. Now, if you're in Nigeria, obviously it's a completely different thing. So things to watch out for in terms of ill health. Now, so I'll start with fever. Now, it's a good idea to have a thermometer at home. I know a lot of Nigerian homes might not have that, but I think it's a worthwhile investment. Now, in children between up to age 1 year of age, we as pediatricians usually recommend getting a rectal temperature. So basically, you have your digital your thermometers where you so insert it into the rectum of the child after lubricating. So pre-lubricating with like Vaseline petroleum jelly or some kind of lubricating jelly, so that it's not dry. So usually if it's a temperature that is less than 102 degrees Fahrenheit, now I don't remember my conversion factors to Celsius, because I know that's what we use in Nigeria, but you could probably just do quick Google search. That would be about 30, I think if it's less than 38 degrees Celsius, I believe. But in 102 degrees Fahrenheit, a lot of times, if it's just overnight, you can give Tylenol or ibuprofen. Now in Nigeria, I know we don't have those brands, so it's important to know the appropriate dosing for that. Now, I know for me, in my practice, I give parents a dosing chart for depending on the child's age, so they know exactly how much they're giving, but also the bottle will tell you how much to give. If it's a convulsion, like a seizure, usually that should warrant an ER visit. The truth is, when we talk about seizures, though, in children less than 5 years of age, chances are that, especially if the child is febrile meaning you have a fever, it's usually what we call a febrile seizure, and that's actually considered normal. Now, if it happens, if you have more than two seizures if you have more than one seizure within 30 minutes of each other, then that's a completely different thing. We start thinking of a whole lot of other things, and getting into that is going to be really deep. So, except if we have specific questions about that, then I can address that. But seizures usually warrant a hospital visit. Now, I know a tradition that we have in Nigeria is to put a spoon in the mouth to try to stop the child from convulsing. We definitely do not recommend that. It's actually better that you let the child seize with no obstructions. Most seizures will just last a few seconds, usually less than a minute. So I know it's hard to watch as a parent, but it's not a good idea to try to intervene. Or I know some people try to put castor oil or something. None of those are recommended because none of that is recommended because the child can actually aspirate and it can cause more problems. So with things like seizure, you should absolutely see your doctor. Obviously, if it's the middle of the night and you're in a remote area in Nigeria, you're not able to see your doctor immediately, that's a tough call. But I would absolutely say, if you can get to the closest hospital, if you can by the morning, absolutely you should be seeing your doctor and getting a good history. If the child had a fever and seized, it's actually reassuring. However, if the child did not have a fever during the seizure, then that's actually pretty concerning. Now, with other things like a diarrhea, so most children will not be dehydrated overnight, except if it's a newborn who's just not eating at all. Now, if that's the case, if you have a diarrhea, here in the US we have Pedialyte, and that's usually what we recommend. Back home, I believe we have ORT, oral rehydration therapy. Now, you do not want to give things like soda, like mineral. You don't want to do that at all, because you're actually worsening the diarrhea by doing that. I know a lot of parents do that, even ginger ale. That's not a good idea. And what you want to replace is the electrolytes, because you're not really losing your sugars. What you really need to replace is your electrolytes. So trying to rehydrate with a proper solution, like I said, ORT or Pedialyte. In older children, you can give Gatorade. I just typically prefer Pedialyte because the electrolytes are obviously more sufficient. And ensuring that you kind of avoid fried foods for the next few days. So giving more bland foods, like we call the BRATS diet, which stands for banana, rice, apple, toast. So basically the whole idea is just giving dry foods, not things that are greasy like fried plantain or jollof rice or palm oil soup. You just want to go slow, and then as the child tolerates, then you increase. I usually say try to avoid those fatty, greasy foods for at least 3 days after the child has a diarrhea. Now, if the diarrhea is not abating, like it's not getting better, then I usually want you to see your doctor within a day or two. Now, if it's an infant that's breastfed or formula fed, that actually I have a lower threshold for, because those children can get dehydrated pretty easily, especially in a tropical place like Nigeria. So for a child who's exclusively breastfeeding, you want to make sure you do not have to stop breastfeeding at all. In fact, you have to be more aggressive about it. What you probably want to do is you might want to give less amount more frequently. So if it's a child that's formula fed, and the child normally takes 4 ounces, you might want to give 2 ounces at a time or something like that, like more frequently with things like diarrhea. And so those are the top things. Now, obviously the things like, when you have abdominal pain, excruciating abdominal pain in the middle of the night, it's usually a lot of times in children, if it's something that's unbearable, you want to be seeing a pediatrician or a doctor as soon as possible, because you want to rule out things like appendicitis. You want to rule out, depending on the age group, again, things like volvulus intussusceptions. There's a lot of things that we think about. So depending on if it's a child that's verbal, that's talking, trying to get a pain scale is important. But for an infant, if the child is not consolable within an hour, you probably want to see a doctor. Now, again, I'll say one more thing, and I'll let you get to the next question. In infants, and I speak again from experience as a mom, what you want to do as infants, if a child is inconsolable, especially in the boys, actually, a lot of times I tell parents to do a head-to-toe check. So make sure, let's say you have a newborn, and again, I'll give an example for myself. The other day, I realized my son was crying, and I couldn't quite figure out what was going on. So luckily, I realized that his shirt was a bit stained. So I actually took it off, and on taking it off, I realized that the tag was still on there. So, the little thing that you're supposed to pull out, the little thin thing, was still there, and he was probably in some significant pain from that. So those are things you want. Sometimes the simple things. Boys also, you always want to look at the penile area for what we call a tourniquet. So things can easily, maybe a mom who has long hair is changing and the hair gets caught in the penis. I've actually seen that quite a few times in my office. So you want to check, because obviously those children do not talk. So if you have a child that's inconsolable, you want to do a head-to-toe check, make sure everything is okay. And then if everything's okay, then that's reassuring. But if the child continues to be inconsolable, you probably want to see a doctor.
Okay, thanks. That was very helpful. The question came from Nigeria, so I'm glad that you answered it from a U.S. and a Nigeria perspective. I have another question from someone, but you've already answered that. So he says his sister wants to be a pediatrician. He wants to know what she needs to do. You've already answered that question, so I would just recommend that that your sister Sumto, your sister watch the recorded video later on to get the answer. Okay, so let's see. I was going to ask if the types of cases changed much since the pandemic started.
Actually, there's been now, and I'm going to put myself on there and be completely honest. In fairness to that question, I've been home for the most part on maternity leave. I actually go back in 2 weeks. However, I've continued to keep abreast of the trend of things. So interestingly, we're not seeing a lot of we didn't see a lot of injuries actually this summer, as we would typically see for a summer, for what we would typically see during the summer, because a lot of children were locked up at home. So they're not outside as much. So we didn't see as many injuries as we would normally see. People also were not going on vacation as they normally would, with the swimming and things. So we saw some of that, but not as much as we typically would see. Now, the real question, well, I guess the real answer I'll find out is, as we get into the fall season, with flu, about to rear its ugly head, and with the pandemic, we don't have a vaccine, we don't really have a cure. It'll be interesting to see how things go. We are actually expecting that things will probably be worse, because you probably will have the flu and the coronavirus. So a lot of now, if you're in the U.S., a lot of offices already have their flu shots available. So we are absolutely advocating for children getting their flu shots early this year. My children will be getting theirs today actually. So there's been a slight change in trend, but we will find, I think we will see the real trend when, the fall and the winter time, when things kind of rev up. Now, as you may or may not know, interestingly, children don't seem to have a serious cases of the coronavirus as adults will. Now, you might have heard of, some of us might have heard of the multi-inflammatory syndrome with the coronavirus. Is actually the serious case of the disease that we see in children who get the coronavirus. So it's something that resembles what we call another inflammatory disease called Kawasaki's, and I'm not going to get really deep into that because I might get you guys confused here. But I guess to answer the question, there has been a change in the trend. But as the months go on, we'll be able to answer that question more in depth, hopefully.
I think you spoke a little bit to this, but what general advice would you give to parents during this pandemic?
Okay. Number one, I would say, please do not hesitate to continue to have your children get their preventative care. So preventative care meaning your well child care. I know a lot of us tend to slack on that in America, but even more so in Nigeria. So for moms who might be listening, you know, in Nigeria and here in the US, a website I always recommend for parents everywhere, you know, it's the internet, is www.healthychildren.org. It's a very good website. It's written by pediatricians for parents. So it's a great website to go on if you have just general questions, you just want to, you know just a few things about just anything really. So I would say do not slack off on getting your children checked, because that's actually one of the most important things we do as pediatricians is preventative care, making sure the child is growing like he or she should, you know, weight-wise, height-wise, you know, their BMI, checking for their lead levels, iron, you know, hemoglobin levels, things like that. So you do not want to slack off on those. And obviously in children less than 1, we get to see them a lot more frequently, every 2 months up until age 6 months, and every 3 months up until age 18 months actually, and then every 6 months after that, and then it goes up to every year. So please do not slack off on that. You also want to have a good relationship with your doctor so that again, I'm speaking, I guess, in Nigeria, so that you feel like you need a doctor that you trust, basically. It's absolutely important, because this is the person that's going to be navigating life with you. It's almost like having a spouse, really. So you need someone that you trust, that you can open up to, you know. And for me, I always tell my patients, no questions are off limits. You know, there's no such thing as a dumb question. I have moms that'll say, oh, I'm sorry if I'm bothering you, this is a dumb question, I know. There's no such thing as that. I'd rather you ask me and then I reassure you and you're right, than you don't ask because you think you're being dumb and then something bad happens. So no questions should be off limit for your pediatrician. If something is on your mind and it's serious enough to cause concern, then it's worth bringing up. It's worth having a conversation with your doctor. So those are some of the things I would absolutely recommend.
Thank you. You spent a little bit of time in Nigeria.
Please, I'm sorry. Don't try to self-medicate. You know, try to have someone, again, a trusting doctor that you can reach out to.
Okay, that's a good one. That's a good one all over the world, here in Nigeria, everywhere.
Yes.
I was going to say, you spent a little bit of time in Nigeria as a doctor. What are some observations that you had about the difference in healthcare in Nigeria versus here?
Mm-hmm. Quite a lot. It was almost concerning. Now, the doctors themselves are very, very, very intelligent in Nigeria. So it's not even about the intelligence of the doctors, but I think what we lack is the amenities, you know, the testing, you know, the finances is a big thing. So you don't have insurance back home in Nigeria. And if you don't have money, then that's a big problem. So a lot of the times, you know, I found that I was basically doing free consultations because I really wanted to. But I find finances that be a big hindrance to people back home. Medicines, you know, you go to pharmacies, you're not exactly sure if you're getting the original, if you're getting counterfeit, if you're getting not the real thing. So that was something else that I saw. So actually, when I went back, I had a whole lot of medicines that I ended up giving away. Like you know, things that we would take for granted here, like your Tylenol, your ibuprofen. Your nasal saline rinses, things like that. So I found that, I guess the most shocking thing to me was, you know, obviously lack of power. So, you know, lack of electricity, lack of amenities, finances. So things that would normally not be a problem here at all. Like, you know, if you don't have money in America, you apply for, you know, CHIP or you know, Medicare for the, you know, for the children. And back home, you don't really have that option. You either have it or you don't. So those were some things that were concerning. But in terms of the actual disease, I feel like a lot of times, obviously you're seeing your things like your malaria, which if you see malaria here in America, you're writing a journal or something about it because it's a big deal. They're going to put you in an ID ward and, you know, do the whole preventative thing, you know, things that are common knowledge in Nigeria. So it was quite a bit of learning for me as well. Granted, I didn't really work full time. It was more like consulting, you know, on my own terms, not really for, you know, a hospital, but yeah.
Okay. Great. Thank you so much. Is there anything else you want us to know about you or the pediatric field?
I think I said most of what I have on my mind, really. Just, you know, I love what I do. Absolutely. If I were to go into the field of medicine again in my next life, pediatrics would be the choice, without a doubt. You know, we are probably one of the least paid doctors, but, you know, I think for me, quality of life is very important, and I absolutely love what I do. Again, importantly, like I said, please reach out to your doctors if you have any questions. You know, I'm pretty open. You know, if you have my digits, you have my number. I'm always very willing to share my knowledge and recommendations. So as a mom, if you're listening, you know, I don't have a platform as of yet. That's probably something I should start working on. But yeah, please have a doctor that you trust. Yeah.
Thank you so much. So actually this webinar is being recorded and I'm going to put it up on our website, professionalafrica.com. There is a functionality there to leave comments. So I know that there are a number of people who are not going to watch this, who are not watching this live and will watch it later on. So for parents who watch this later on, this is going to be on professionalafrica.com. /videos, and you will be able to leave your comments on that page, and then Dr. Nnamani and you know, perhaps some of her friends can respond to the questions that come up. So I thank you so much for your time, Dr. Nnamani, and well, I should say Amaka, my sister, for joining us on the Lifeline. Everyone visit professionalafrica.com for professional development master classes and knowledge sharing videos that will differentiate you in the workplace. Also, please join us in 2 weeks on Saturday, October 3rd, to find out how to work in the US. So wherever you are in the world, find out how to enhance your chances of getting a job in a Fortune 500 company in the US. We're going to have an HR specialist, director actually in the US, talking to us about how to get work in the US. Okay, so again, thank you so much for joining us today, and we hope to see you next time. Bye-bye.
Bye.
Bye.